are Sharing Hope SC facilitates life-saving organ and tissue donation across the state of South Carolina. I talk one-on-one with Krystal Cau, the Director of Communications for this organization, for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Krystal Cau, welcome to Quintin's Close-Ups.
Hi, Quintin. Thanks for having me.
Oh, I appreciate it greatly. Needless to say, you are the Director of Communications for We Are Sharing Hope SC, which is South Carolina's federally designated organ procurement or organization, better known as OPO. And of course, you all facilitate life-saving organ and life-enhancing tissue donation across the state. And as you know, that your staff stands mission ready to support families throughout their loss and offer hope through the gift of organ and tissue donation. So tell me, what's new, what's now with the organization?
Right. So currently in South Carolina, we have over 1,800 people that are on the wait list, waiting for a life-saving gift. So that means that we need more people to become registered donors so we can ultimately save more lives. Across the United States, there's over 104,000 people waiting. So there is a great need for more registered donors. So part of our work is being out in the community and educating, dispelling a lot of those misconceptions and sharing with people the impact that donation can have on so many people's lives.
Well, let me ask you, how many registered donors do you need currently?
Just with those numbers alone, when you look at over 1,800 people and not being able, people in great need are going to go to the top of that list. So just for one person saying yes to donation, there's a potential that they can save up to 8 people's lives through organ donation. And with tissue donation, there's a possibility of enhancing up to 75 people's lives. So making that decision is a selfless decision, and it can really it's a ripple effect of saving and changing people's lives.
And I know that you all want to change lives, Krystal. So what misconceptions do you want to dispel in the community?
Sure. I think, specifically during August, it's National Multicultural Awareness Month, and there's a lot of misconceptions and disparities within multicultural communities. There's a higher need for kidneys within African Americans. And so we really want to engage them, provide them resources to preventative health care, and then also just share the facts around donation. There's misinformation throughout the media, and they may just have lack of resources and not being informed with the actual impact and the facts surrounding donation. So that really is one of our mission. Part of our mission is advocating for donation, inspiring people with these stories from donor families that have gone through that and how it really can impact their life in the long run.
Oh, absolutely. What resources do you have available for those particular people who want to donate?
Sure. So people that want to become registered donors, we encourage them to share that decision with their family. So at that time of tragedy and at the time of death, their family is able to honor their wishes. So it's very easy to become a registered donor, either going to your local DMV, going to the registry online, which you can visit at sharinghopesc.org, or going and on your health app. If you have an iPhone, you just takes 2 seconds to check that box and making a lasting impression for so many people.
So many people. Right now here in South Carolina, what else do you want to dispel when it comes to this?
Sure. I think the biggest thing that we hear from people within all communities is if I have a heart on my license and something happens in a hospital, that medical professionals will not save me, which is not the case, but we hear it frequently. Medical professionals will do everything that they can to save an individual that is in need, but when an individual is pronounced, when they declare death, that is when our organization, Sharing Hope, will then offer the family the opportunity to give the gift of life.
Man, that's amazing to give that gift of life right there. As you know, Krystal, everyone's glued to their phones these days.
True. Guilty.
How do you all keep up with this growth and spread the accurate information to those folks online?
Yeah, sure. So we have statewide campaigns. We have donation drives where we're encouraging people to come and register. So we are very active within our social media platforms. So we definitely have several different avenues where we're able to engage the rural communities within, across the state of South Carolina, because we are the federally designated organization, like you said, serving the entire state. So we are small and mighty. So we definitely have to get creative with how we are meeting our community where they are.
Where do you meet them where they are right now?
That's a great question. Where don't we meet them? Whether we're at a health fair, at an expo, within churches, with faith leaders. So they're, through our hospital partners, we do a lot of work, and we're constantly changing it and implementing new ways that we can really engage with our community that we serve.
And what are those ways right now that you want to implement for the community?
So the ways that we're doing right now, throughout the month of September, which we're gearing up for, we do a whole DMV tour. So we go around the state, engaging with all of our DMVs, meeting our community members. So we're constantly getting creative with new ways that we can dispel a lot of those misconceptions, further educate, and provide resources for the individuals to make informed decisions and then share those with their family members.
And you talk about obviously touring the state of South Carolina with those DMVs, and you mentioned earlier about those rural areas. What are the disparities right now in the rural areas that you all want to tackle?
Well, there's a lot of mistrust, so we have to build that trust, which takes time, so we want to be able to, we want our community to feel that we're able to be a resource for them, but also answer questions that they may have. The mistrust may come from something that they read, a show that they may have seen that, that's not factual. So we really just want to be able to engage them, but also we understand that it takes time to build that trust. But I will say, mostly within those rural communities, there's a lack of trust there. So we have to really work on that to build their trust and, to form a relationship.
And you talk about forming a relationship. So if anybody wants to register to be a donor right now, how do they go about that?
So you can go on the actual registry, which is Register Me, or you can go on our website, sharinghopesc.org, DMV, the health app, but also go to our website and learn more about the impact and reach out to us. We have a volunteer program. We welcome our community members to get involved and advocate for donation. And it's really a way for them to then engage with our transplant recipients and donor families that have been through that process. And they can share their stories and how during a time of tragedy that they were able to honor their loved ones' wishes to give the gift of life, and that ripple effect that has had on them. So when that happens, those donor family members come out to all of our events. They want to share the impact and their positive experience that donation has had on them and their families.
And quickly, for those who want to actually volunteer, how do they go about that?
Also on our website, sharinghopesc.org, we have a great volunteer program. We list all of our events that we do annually, and we are always active doing something on a monthly basis. So I would definitely encourage people to check it out if they're wanting to get involved and reach out to us.
Well, that's amazing. Well, Krystal Cau with We Are Sharing Hope SC, thank you for your time again. Welcome to Quintin's Close-Ups.
Thank you, Quintin.
You're welcome.